This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the brilliant Dr. Jason Martin.
I'm very brilliant.
Board-certified plastic and reconstructive surgeon.
Board-certified. It's like a double dagger. Double
whammy. Dr. Martin, it's January 1st, 2023.
I know, it's crazy. It's crazy. I remember 2019 when you said 2020 is going to be an amazing year. So I do not want you to have any predictions.
No. Trust me. After that, after my 2019 prediction,
you were way off.
Yeah. I am not Nostradamus. It was epically off. If you are watching this podcast, which we do highly recommend, you can find us on YouTube at Jason Martin MD. We got some new mic arms.
Yeah, it's pretty interesting to kind of rotate these around.
So
very professional.
If you have always been a listener of the podcast, we really appreciate you listening, and you may have heard of some bumping. We would sometimes tend to thump a bit, so this is getting rid of the thumping.
I kind of miss the thumping already.
Hopefully, but give us feedback if you like the arms, if you don't like the arms, if you see us messing with them a little, it's just because they are brand new to us on January 1st. We got some new equipment in the office here in the podcast office. So we have a great topic today, and this was actually recommended by our famous now. I mean, she's our famous listener from Sweden, blah, blah, blah.
We're huge in Sweden. We're like number one.
We're growing every day. We're ABBA. So she sent me an email and noticed that we did not have a episode about lip lifts.
Oh, which is such a good topic.
Yep.
We do them, and they actually have really good results. So, and it's very interesting. A lot of people actually are candidates for this procedure, surprisingly.
Yes.
So I think this could be a really good episode.
Yeah, so it was a great suggestion, and we really appreciate that. If you would like to leave us your suggestion for a future episode, please call me. The number is on the screen.
Right down here.
Via the magic of nils. So please call, leave us a voicemail. You can always send me an email as well. And all of that is in our description box. So if you can't write it down quickly enough, it's in the description box. So as our timestamps for this episode. So let's jump right in.
Okay.
We always start with the statistics. We are still looking at the statistics from 2020. I'm super interested. So probably about halfway through the year, they'll come up with the 2021 statistic report. And it'll be really interesting to see the increases, I think, year over year. You know, they actually are showing that we always see the 20-year difference and then the year-to-year difference. And they've started breaking it down between male and female, which is super interesting, especially with a procedure like this, because I think most people would assume that this is something that only women do. Which if you look at the numbers, out of the 34,000, and this is lip augmentation and lip reduction, we'll talk about the differences, but I had Sarah put up both to kind of see that.
So it's combined.
Well, I mean, they don't break down the numbers for lip reduction between men and women. They only break down the number of lip augmentation between men and women. So for women, it was the bulk. It was 96% of the total procedures performed, which was around 33,000. Men were 4%, which was around 1,200. So not as many men. I would assume, and this is just my assumption, which could be way off, that the number of lip reductions may be slightly higher in men. Most women don't want their lips to be smaller, as we know with things like filler, and this does not include filler in any of this. Make their lips bigger. Not a lot of men get filler in their lips, but a lot of women do. Surprisingly enough, too, there was not a whole lot of change in this procedure over just year over year. So it has gone up a lot in the last 20 years, gone up by 84%.
Which is very evidenced by the fact if you go to the state of California, I mean, every lip is augmented. So I do not believe this 30,000 number here.
Well, this is non-injection.
Oh, okay. Non-injection.
Yep.
Got it.
Yeah. Injections are in the millions, 4 million injections.
I think it's in the trillions now.
Well, I mean, this is just with board certified plastic surgeons. But
I don't care. I mean, this over-injection of lips is a little bit concerning.
Yeah.
So.
And this is, I think lip augmentation, we're calling it lip augmentation. We will talk a little bit about lip implants in this procedure, but we're more focusing on lip lifts.
Yeah.
For a good reason, and we'll talk about what that is.
But permanent lift augmentations, which we don't do as much of, so we're definitely not the office like experts at that procedure, are there's multiple kind of implants that you can use. There's silicone ones, there's ribbon ones. So there's different types of procedures you can do. And they actually have really good results. And that doesn't even take into account fat grafting, which we do a lot of. So, but by and large, I think the majority of people that augment their lip, they're going to do it with fillers alone, which are transient. They only last an X amount of time.
Correct. And lip implants have pretty distinct downsides over other types of lip augmentation.
Not according to the people that sell it.
Right. I mean, the biggest one being, when you're putting something in the tissue of the lips is extremely delicate. Mm-hmm. So if you put a silicone or any type of foreign substance in that lip, if you were to want to take it out,
it can be difficult.
Correct. It's going to leave you with a deficit that is going to need to be addressed in some way. Now, does that mean that you can't have your lip implant out? No, you absolutely can. The other issue with lip implants is that they are very tactile. You can feel them. They can change how you talk. They can change how you smile. They can change your expressions. And that's why, when you're looking for other options for lip augmentation, most practices are not going to jump to lip implant. They're going to offer you some of these other things first, like fillers, fat transfer, things that are a little more natural.
Yeah. And the other problem with lip implants is infection. Mm-hmm. I mean, these infections could be terrible, especially around the mouth. So, Amy, what's worse? What has more bacteria in it, a human bite or a dog bite?
A human bite.
Yeah.
Yes.
The type of bacteria we have in our mouths, I mean, I'm sorry to say this, is like terrible. So, those infections, oral infections, lip infections, even if there's no implant there, can be terrible, can be really problematic. And once it gets around an implant, it can be a huge issue. Usually you have to get hospitalized on IV antibiotics. So I think, I'm sure we'll talk about this, but you have to think twice about lip implants per se. They do work, and if they're done correctly and a little, conservatively, they're a great answer. I mean, because it's permanent. But I think that
it's permanent being in quotation marks there. Yeah. No surgery is permanent.
You're so Socratic. You always have to shoot everything down. This pie in the sky that we live in with plastic surgery, you always have to tell the truth. It's pretty annoying, actually. But
I would be interested to actually see the statistics on what the lifespan of an average lip implant is.
I don't know.
I would guess it's kind of up there with calf and buttock implants.
We should do another episode on that. I don't know. I have no idea.
Yeah.
Okay.
Yeah. So let's talk about lip lifts, because that's, I think, what most people are the most interested in.
Because that's like a newer in vogue procedure.
This is a very TikTok friendly procedure, right? Everybody's getting lip lifts because, we all kind of want that fuller look to the top lip. For younger people, I would say it's definitely more something that they want a lot of fullness of the upper lip. For older people, what tends to happen is that the distance between the base of your nose and the top of your lip, or that Cupid's bow, lengthens.
Right.
As with all things on our face and all things on our body, gravity is affecting everything, ligaments, skin stretching. It's so that aged appearance of that kind of flattened out, wide, flatter space in between the nose and the mouth is very aging.
Right. So with age, we've said this 1,000 times on this podcast, you get thinning of the skin. Right? That happens. That's inevitable. It's worse in lighter skinned people over darker skinned people, but the skin thins. Secondly, you lose, Amy's favorite thing to talk about is elastin, that ability for the skin to snap back. And then what we're finding out recently in the past 5 to 10 years in studies in plastic surgery, you lose soft tissue also. So it's a perfect storm. It's an area with a lot of movement. The orbicularis oris muscle, with a circular muscle around your lip, can cause diminution of the soft tissue attachment. So you get loss of soft tissue, you get thinning of the skin, and you get stretching of the skin. And for older people, that can lead to a real change in the appearance of the upper lip. The upper lip has muscle, has soft tissue, and it has wet and dry vermilion. The dry vermilion's on top. Amy, you have really nice dry vermilion.
Thank you.
Yeah. The wet vermilion's on the inside. So that makes up the lip, and you can see, especially with age, that can change drastically. And you can get lengthening of the upper lip by
millimeters. It can be very dramatic.
Right, like a half a centimeter.
Yeah,
which may not mean a lot, but it really is a lot over time.
Yep. And let's say you have this thinning of the upper lip, what are most people going to do? They're going to fill it up with filler. Well, filler doesn't really address the issue if what you have is an actual increase or lengthening of that space there. Filler can kind of push the lip out slightly, but that comes with some downsides too. Not everything has its opposing side, is that, then you have injections. They don't last very long. You're getting your lips filled every 4 to 6 months on average. You may not actually get the look you're going for, because while that can push the lip out, it doesn't really address the main issue, which is that excess skin, that excess space that's right there.
Mm-hmm.
So a lip lift is lifting the upper lip, just like it sounds. This is one of those surgeries that actually
imagine a tummy tuck, but for your lip.
For your lip. So where does the incision go, you may be asking? Well,
this is the magic part, right? Where does the incision go?
Right, it's magic.
Because you're putting a scar on your face that's visible. Where would you put that?
Yeah, so there are two places where you can do a lip lift incision. One of them, I would say, is never really used, at least in what I have seen in plastic surgery circles, is to do an incision at the edge, like out by the lateral third.
It's like huge in Asia. They do these kind of corner of the mouth lips and put the scar right on the edge. Yep. It's probably more common in women who wear lipstick because you can kind of cover it up. But it will lift the edge of your mouth because the modiolus, which is my favorite word in plastic surgery.
Modiolus?
And no one knows it, Look that up, modiolus. Right? Put that down here, Nils.
Modiolus.
Okay. It's probably not even in the dictionary.
It absolutely is in the dictionary.
Oh, okay.
Modiolus is a real word. It's in the dictionary.
All right. So the edge of the mouth, where all these things attach for lifting, that can droop also. And so you take a kind of a triangle of tissue out on the edge and bring the edge of the mouth up. So that I've seen that before. It's more common in Asia, not as common here. It's a visible scar. That's the only issue with that. And it only offers you a little bit of a lift.
Yeah, and it doesn't get to it's not really treating that aged appearance of that lengthened, space on the upper lip.
Yeah.
So the way to address that is you do an incision, and if you, look at our YouTube channel, and I was showing a picture of where that incision goes. So it really does just trace directly under the nose, and that goes all the way from the edge of the ala to the edge of the ala. So all the way across.
Amy, what is the ala for our listeners?
So
because you just pointed at your nose,
you're going to
and the
plug your
listeners
nose.
can't see it.
Exactly. So that's if you're going to plug your nose, like when you plug your nose to go underwater, and you pinch it shut, like that's what you're pinching. You're pinching your ala together.
It's basically like if you have the tip of your nose and you go to the outside, those are the ala, those wings that cover your airways, are the hoods of your airways, the airway hoods.
The nostrils, yes.
Where the nostrils are, yeah. So that's the ala.
So you may be thinking that seems like a very long incision to do a very little lift, but you need to have it be that whole length because the incision has to end somewhere, and a natural place for it to end is kind of curling up onto the edges of the nose because you don't want it to be straight across. So it kind of curls up and follows that natural curvature of the nose.
Right.
So it's completely hidden, but it is a long scar. So when it's very fresh, like you have, probably 30 tiny little 6-0 sutures all the way across there. Like it's closed from the outside, so there are visible sutures right after this procedure all the way along there.
Yeah, so it goes from the alar crease to the nasal airway, right? And then around your columella, the base of your columella, which is that central tent pole that divides your two nasal airways, back to the other nasal airway and the other alar crease, and that's what it does. And it does it in this seagull pattern. What would you call that? Mustache?
It looks like a mustache.
Okay, mustache pattern.
It looks like a mustache. It kind of, or like a wave, like a very stretched out wavy
it's pretty elegant, and I love it. I love drawing it out.
Yeah.
And,
well, because it's like mirrored. It mirrors itself, which is interesting. Like not a lot of our stuff does that.
And then a lot of people don't see these surgeries. So this is usually an add-on procedure for me, like with a facelift or something.
Or a rhinoplasty.
That's nose job. And you draw it out, and people, like everyone in the room is always like, "What are you doing there?" Like, I don't get that.
It does look like you're drawing a little mustache.
It does
look
like okay, what is he doing?
Yep.
And it works really well. Because the main thing is when you get lengthening of your lip, your upper lip, and that's not the vermilion, the red part of your lip, red or dry or wet. And when you get a lengthening there, the lip itself tends to turn in. So that dry vermilion show becomes less. And when you lift it, it actually everts the lip a little bit more, giving it more show of the vermilion or the red lip itself. And that's primarily what you're doing. You're also decreasing that length between the base of your nose and your lip, which just looks better. I mean, if you look at little babies, they have just a short space.
That's actually, I was going to send it to Sarah to put in. There's a picture of you and I holding Gideon, who's our medical assistant's son, when he's about 3 months old. And oh my goodness, it's perfect. It's that little upturned lip, like that space is so tiny. Like it's just the juiciest little thing ever.
We should all go back in time.
Yes. But it is very useful.
So it sucks getting old because I just want to look like I did, maybe not at 3 months.
No, I don't want to go back that far.
What's a good age for babies?
No, if I could go back to an age, I would go back to being like 33. Like I have a picture of myself when I was 33 and I'm like, man, that was, of course I'm only 25 now. So I don't know how that's possible, but 33.
Yeah, I don't know. 33, I wasn't that healthy.
But imagine yourself now At 33.
Okay, so you mean with my focus and working out and nutrition? Yeah, hell yes.
Yes, if that was you.
Dude, I'm going for 28. I'm not going to be in surgical training. I'm going to be, kicking ass in the gym every day.
But see, that's why 33
traveling.
is
I'm going to have unmeasured wealth too. I can go anywhere and everywhere I want to go. Let's do it for a week, and then come back to my hardworking life. But so
with perfect lips.
Yeah. So the lip lift it's pretty straightforward. It's not as complicated as people on the internet and TikTok make it think. I mean, if you have an elongation of your upper lip or the space between the base of your nose and your upper lip, shortening that space is going to have a better visual effect in terms of proportionality, and is going to upturn your upper lip. And by the way, showing more vermilion is what you do with fillers, right? Because it kind of
does that same upturn.
It everts it out a little bit with the volume. But the problem is people overdo it all the time, and you look weird. I'm sorry to say that. It just doesn't look right. It looks disproportionate. So this is like a really great permanent way to bring back good proportions of your upper lip, both the vermilion and the space in between your nose and your red lip.
And you may still choose to do filler or have fat transfer or something else at the same time. I think it's important for people to understand that this is addressing two different things. This will not, by default, make your lip fuller, but it will make it have the appearance of being fuller because there's more show of the whole lip. You still may want more volume, but it kind of brings the lip into a more natural position.
Right. And I think that if you really were deficient, like the kind of quintessential surgery would be a lip lift with fat transfer to the lip. That's where you could get added volume that you may need in the upper lip, and also the lifting of the lip itself. So let's briefly talk about lip reduction. We won't spend as much time talking about this because, like I said, it is less common. So Dr. Martin, what is a lip reduction? Well, I've done these before, and it's usually post-traumatic, but you could do it for other reasons. Again, different cultural backgrounds could have bigger lips and they want them reduced. Again, that's not usually our patient base, but this is talk about my experience in post-traumatic injuries where people have areas of their lips that are distorted looking. They have more volume to them in comparison to the others. And
usually because of scar tissue.
And you can do a lip reduction. Now, the way I do those lip reductions, and I don't know if you have pictures of this.
I don't, because it's just, that's why it's like making one picture, like there's so many, it's too much to pick one picture.
Is I actually put the incision on the inside. So we talked about the vermilion, the dry vermilion, which is the outside, which is beautiful and Amy.
Thank you.
Do you get injections in your lip or no? You can't tell us? Okay, that's HIPAA. that's a HIPAA violation?
I don't know, do I?
I don't even know.
Like you don't do them. Yeah, exactly. Yeah. If I did, you would know.
Are you cheating on me, Amy?
I would never. Nope. No.
Okay, well, anyways, you wouldn't put, if you're doing a lip reduction in most cases, you wouldn't put the incision on the outside, the dry vermilion, or where you can see the scar. So I put the incisions on the inside of the lip, or the underneath part. The mucosa part, the oral part, the part that covers your teeth, okay? And then you would orient that horizontally or along parallel with the lip itself, and you could reduce the whole length of the lip if you wanted to. Puts a scar on the inside, it rotates everything back in as opposed to the opposite of what you're doing with the lip lift. So that's technically a lip reduction. You can do that in the upper lip or lower lip too.
And I think you hit on the big one there, and that's how kind of I would reduce it down, is that you have a lip that's over projecting, and you see that on some people, like their lip almost sticks out.
Yep.
Or they're not able, even when they close their lip, the wet vermilion is still visible. You see that more with, I'd say, the lower lip than you see that with the upper lip. But in either case, it kind of helps bring that back in, versus like with a lip lift, we're kind of trying to bring it up and out.
I think we would be remiss if we did not, is it remissant or remiss?
Remiss.
Okay. I think we would be remiss if we did not bring up dentition and occlusion, so your teeth. So as we age, we have something called osteoporosis and osteopenia. The maxilla, which holds the upper teeth, and the mandible, which holds the lower teeth, can get smaller and lose its volume and strength. And so the teeth tend to shift, which then can translate to the lip. And I can tell you, with me personally, being someone who is technically not over concerned with my appearance, but is important for what I do for a living, I can tell you without emotion that my upper lip appearance has changed immensely. And I don't think it's just because my upper lip skin has lengthened. I think it's also because my teeth are shifting with age. And you'll see.
Well, but you have had your teeth adjusted, and I would actually agree with you that your upper lip does appear somewhat thinner.
Yeah.
Since you did your Invisalign.
Yes.
I would absolutely agree with that.
Right.
Yep.
And and that may not be a bad thing for me. I think maybe I had too much lip show because my teeth were starting to become not disorganized, but malpositioned. And so it gets very complicated. In reality, if you're doing this correctly, you would fix your teeth and your lips at the same time. But
if you need to, yeah.
In most cases, like if you're middle-aged, if your teeth are changing, but most people are not going to do that. I mean, the cost of that alone would be astronomical. I mean, Invisalign alone is expensive.
I say your lip lift is going to cost way less than your Invisalign.
Yeah, I know, because you can. By the way, you can do the lip under local anesthesia. Yeah, we didn't say that.
Lip lift can be done in the office with you awake. Invisalign
is, really nice.
is going to cost you way more than a lip lift in most places.
Right. Yeah. And you know what's so funny about that when you do the Invisalign, which I really like, so I highly recommend it. It's so obvious. It's a computer program and algorithm, yes. Right? So you go into your dental office. We love our dentist, by the way. He's awesome. He's amazing. Yeah. And you go in there, they're like, okay, let's try on the tray. After you do sequential three, and you go back in, make sure everything's fitting right, and then you go home. Like there's really no thought process to it. So it's the actual production value of these trays and that computer program, whatever the intellectual property of that computer program is. Mm-hmm. And I'm not sure how much energy and education that takes.
Yeah.
I think you and I could do it. I think if we wanted to start our own business, I don't know if that's illegal, but
probably.
Yeah.
But I don't think there's any secret sauce to it. But
no. But anyways, yeah, so you would have to fix your teeth also. And that's true for lip reductions. A lot of people you'll see with a lot of lip show, they have teeth problems.
Mm-hmm. Or an occlusion issue.
Or occlusion issue. And that usually is people that did not have braces when they were younger, for whatever reason, for financial reasons or
have just a congenital kind of defect there. Yeah, that is interesting you brought that up about yourself. I would never throw you under the bus like that, but you are correct. Like the Invisalign did change and you, to be fair, like for a man, you have very full lips. So like you have, I would say now it's almost like there's an imbalance.
I don't want to be like cocky about it, but I mean, I kind of have full lips, Amy.
You do. You have, yeah. So,
I don't even know. I do this for a living. I've never really quantified the volume of my lips. Yeah, just to be very honest with you.
But it's almost like now there is more of a slight imbalance because your upper lip is not as full as your lower lip.
So you're thinking that the Invisalign screwed the way I look?
Maybe we just need to give you a little bit of lip filler.
Yeah.
Maybe it's your turn.
Maybe we could sue the dentist.
Like you didn't tell me about that.
You've ruined my pouty lips.
But we have a solution for that. There we go. Lip lift.
Oh, I'm going to lip lift myself.
Mm-hmm. Yeah, yourself.
That's going to be interesting. You're going to do it. Okay.
Yeah. All right. Let's take a quick break. We're going to come back and talk more about the details of the procedure, downtime, recovery, all the stuff everybody really wants to hear.
And we're going to be adjusting our microphones while you're
all
away.
Along the way. Let's get checked. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about this sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. And we're back. So if I did not mention this at the beginning of the podcast, it is January 1st. I mentioned that part. What I did not mention is that we are in the midst of an Arctic blast here in Denver.
Yes.
And I think the real field temperature when I was walking over this morning was like 5.
Yeah.
So balmy. So if you hear a big whoosh sound.
My wife went out to jog today, and I looked out the window, and of course I couldn't hear her, but she was mouthing, "Oh,
yeah, it's cold. Like that'll make you suck the air right back in."
That's when you know it's cold. And she grew up in Chicago, which is like brutally cold.
Yeah, it's a different kind of cold. So if you hear a big like whooshing sound, it's the aggressive HVAC heat trying to keep us from freezing to death.
Yeah, and if we're doing some house cleaning, I got to give a shout out to my son Jacob, because it is very funny doing this for a living. My kids have never cared about anything I've ever done. Okay, I'm extremely successful, and they could care less. I mean, literally, when there's a medical problem, they ask their mom. Okay.
Well, she is also, a doctor.
So apparently, my son Jacob's friend in high school, she wants to become a medical professional. I'm not sure what she wants to become. I'm reading between the lines. Maybe a surgeon, dermatologist, nurse.
Well, how pretty is she?
Nurse practitioner. I don't know. Anyways,
if she's super gorgeous, it's got to be dermatology or orthopedics, because
exactly.
they need more beautiful
exactly.
people.
Good-looking people don't go into plastic surgery. That's for sure. We've noticed that with the plastic surgeons. But anyways, he wanted me to give him a shout out. So Amy, can you please give my son a shout out?
Well, this is actually a shout out that I'm going to say. I saw you on the street, Jake, and I didn't say hi to you because you were with your friends. And I wasn't sure if you want me to say hi to you. So I didn't. But I did see you guys working really hard cleaning up somebody's yard. It was about a month ago because the leaves were all fallen. And so this was my shout out after the fact.
He wanted a car. Okay. Car takes money. Money doesn't grow on trees, so you got to go rake some
Actually,
leaves.
it might if you're raking leaves.
Actually, that's true.
Yes.
That's
money does grow on trees,
like
and then it falls to the ground, and that's where the money is.
And especially in the rich neighborhoods. So keep doing that, Jake. That's good.
So sorry I didn't say hi, but I didn't want to embarrass you.
Shout out to your friend, whoever that is, which you won't tell me her name. Okay.
Well, friend. Okay. So let's talk some more about lip lifts. We're going to talk about lip implants. We kind of talked a little bit about it at the beginning, but this is what it sounds like. This is actually an implant. They're made of silicone. They're very soft and flexible. They come in different sizes. They can also be done in the office. It's just a small little, we numb it up, make a little puncture mark, slide that implant in, get it into place, and then you just have to be really careful not to get it displaced while it heals. Your lip is a very soft surface, so you want to really treat that lip implant very delicately for the first 6 weeks.
Yeah, and this is not like our area of focus, but there's different types of lip implants. And originally there was silicone. Now there's like these kind of more ribbon, kind of woven material implants that people use. And those tend to be
Those are the ones that are meant to integrate a little bit
Yeah,
more.
they integrate more. They create some sort of substrate or foundation that the soft tissue grows into. And
I love when they call it substrate and not just scar tissue.
Yeah.
Interesting
that was kind
marketing
of a
right there.
maniacal laugh you just had there.
Like, let's call this what it isn't.
Let's call this substrate.
Yes. Integrates scars in.
Sorry, Nils. Was that a little loud? Yeah.
So yes, I mean, so there are risks with implants. You're obviously inserting something like there are with any implant in the body. You run the risks of infection, extrusion. You can feel the implant. It may become displaced. It may flip. It may rotate. Like there's a lot of things that can happen. You may not like the way it feels.
Yeah. And by the way, like this is true for all facial implants, for cheek implants, chin implants. We should do an episode on chin implants. And there's actually, they make ones now that go on the forehead, that go on the brow.
Yeah, jaw. I mean, you can get implants along the jaw, even like and
there's some people that specialize in that. There's, in gender affirmation surgeries and things like that, where it gets more specialized. So this is a whole other area of plastic surgery that takes nuance and true expertise. But all the problems with implants ultimately are scar tissue. I mean, this sounds like the breast implant episode.
But this is implants. This is any implant in the body.
Scar tissue around the implant, infection of the implant, and malposition or rotation. And you can see that with the chin implant. We get that a couple times a year. People come in with chin implants.
Whoo, yep, getting used to the arms. Whoo, scared myself.
I know Nils is going to cut that, but that was actually
that was
really
scary. Yeah.
What was I saying?
Chin implants that they can become displaced.
Oh yeah. So a couple times a year, we'll get people to come in with chin implants that are malrotated or, kind of rotated.
Well, and chin implants are actually screwed in. A lip
not all the
implant
time.
is not.
Not all the time. Not all the time. Yeah, but you're right. I mean, that's what we do more recently is you'll put a screw in there, just keep it in place. But it can still rotate even with the screw in there. So.
Well, and as the bone changes, as you brought up, I mean, specifically the longer bones of the face or the larger bones of the face, if you have a chin implant placed when you're in your 20s, then by the time you get into your 40s, you may not like the position anymore. I think that's key with any implant. Never think of this as a one and done procedure ever. Breast implant, lip implant, chin implant, calf implant, butt implant, any implant at all.
Again, you're just like popping every bubble and balloon that we have in plastic surgery.
Yep. So in your mind, if you're getting a lip implant, just know that this lip implant will likely need to be changed at some point in your life.
The problem is, I mean, if you go to a board certified plastic surgeon or board certified facial plastic surgeon, somebody that's had a lot of training, I would assume that they're going to sit down and have a long discussion with you about that. But a lot of times people just do this in the dermatology office. I mean, nothing against dermatologists or just a regular aesthetics office to do some of these things. And they're not having this like long-term discussion with you, which is a problem.
Well, they might not even be capable of managing the complications that come with these
And they're
procedures.
not, because we're the ones who manage them, unfortunately. So you have to think about with these implants, albeit I think they're really good. I think they successfully accomplish what they're supposed to accomplish. There is a long-term consequence to that. I strongly feel that fat is better just because it's more well tolerated. You can redo it if you need to as your body changes. But even injecting fat, which I think is safer and better because it's, from your own body, is very problematic and takes
filler.
And takes a lot of skill. And if you over-inject fat, that's a disaster because it's hard to get the fat out. So I don't know. I think implants alone, I think you need to really think through it before you do an implant.
Yep.
But implants can be taken out. At least the silicone ones are easy to take out.
Yep, they come out.
You can kind of just pop them out pretty easily.
Yep. But just know that when that implant comes out, especially if you've had it in for a long time, it has caused changes to the soft tissue in that area that may leave you with an appearance aesthetically that is not pleasing.
Just like taking breast implants out. If you have large breast implants, you take them out, your breasts are going to appear more saggy than they were when you put them in.
Yeah.
It's the same idea with the lip.
Yeah, and everybody
Same
sees
idea
your
with
lips.
earrings. What were those gauge earrings that
that's
were
what
really big?
they're gauges.
Yeah,
gauges.
Nils loves those. Nils had like 3 of those.
Yeah, so I think really what we're just trying to say is lip implants can be great. They come with risks of surgery like anything.
And his nose ring and his facial tattoos.
Right.
Never in piercing. Never.
But just really think about
It's
it.
very un-Viking-like, man.
Yeah.
No piercings,
Also,
yeah.
if you're a boxer, it's not a good thing
No.
to have metal in your face.
No piercings, yeah. So really think about it. Like have a long discussion, really understand the risks and benefits with lip implants. All right, who's a candidate? We have
Homo sapiens? How about that?
Yeah, men and women, anybody,
lips.
people with lips, exactly. I think it is probably a misnomer. I mean, obviously we saw only 4% of lip augmentation procedures were done on men. However, men are great candidates, and men have the same amount of lip thinning that women have.
You've already established my lips
Yes.
are looking nasty right now.
No,
after
they
the
just look
Invisalign.
different. They just look different. Men do have some, I always am going to go back to the genetic advantages of men. Their skin is thicker. It's not as noticeable. When was the last time we had a man complain of like vertical lines on their upper lip? Never. But women complain about it all the time. So aging does affect women in this area probably more aggressively and more notably than
That's
men.
true. Because men have thicker skin.
Exactly.
I think that the
They have
thinning of the skin,
beards.
they have more collagen, it seems like.
Yep.
They
Just
have more hair
tensile
there.
strength.
That hair is more supportive. Maybe they have bigger muscles of the face. The bones of the face are bigger.
All of that. We talk about that on all of our episodes about face, anything on the face for men. You have those things, stronger muscle, more bone.
Yeah.
Just genetically you have them, but that doesn't mean you're not a candidate.
So it's funny because men tend to be more overweight, so their necks are always the problem.
but
fatty
they also
necks and saggy necks.
tend to have less weight fluctuations in life, which again, we talked about that in some of our facial procedures. Like it helps maintain the integrity of that skin if it's never stressed as much, So men who maintain their weight throughout life are going to have less facial aging.
Right.
But men and women, anyone really over the age of 18 is a candidate for this procedure. It is a very hot procedure right now on things like TikTok, and is it a good procedure? Yes. I mean, there are downsides with any surgery.
When
but
you say TikTok, it makes it sound like you're 80 years old.
what
like
should I say instead?
No, the way you say it, like on TikTok. I mean, do you think TikTok now is the number one social media app in the country by usage?
No.
Yeah, I don't think so either.
But is it where things become the most buzzed about?
Right,
Yes.
the most viral stuff.
Yes.
Yeah.
Is it, are lip lifts, would I say they are viral on Instagram? No, but are they viral on TikTok? Absolutely.
Yeah.
So that's why I'm using TikTok as the example here, because medical procedures tend to kind of have more, and just anything like recipes even. Look at the guy who, oh my gosh, like you get like 10 million views on a recipe for something. So that tends to be more why I go there.
Yeah.
Do I personally use TikTok to look for medical procedures? No, I do not. I would not. However, the young ones do.
Yeah, it is really interesting. If you actually, anyone listening to this, go look on TikTok and just look up medical procedures because it's hilarious. It's like some information and then entertainment,
Well, there's the guy, it's the one who mocks doctors.
What's his name?
Oh my gosh. I'll send it to Nils. I send it, Dr. Martin sent
He'll
it to
put it
me.
on the screen,
Yep.
whatever that is.
It's amazing. So this guy does like parodies, and there's one where he's, pretending like he's a new anesthesiologist and he has to go talk to the surgeon.
No, I saw this one. Is that the potassium one?
Yes. And you said that to me. I love it. I'm like, what's potassium? I was like, can't we just give
yeah.
him more potassium? Can't that kill the patient?
No, he's like, so there's the headed, so he plays all the characters.
Yeah,
and everything's a minute, like in TikTok, so he does it really fast. And he is actually a physician. Apparently he had a severe medical problem and had to stop practicing or for the interim. So
Oh, you really went deep on this guy.
No, yeah, I was so interested in this guy. So he's actually a physician, which makes it more interesting because he's actually entertaining, which most physicians are not entertaining, and me included. And he's playing the anesthesiologist, and then the medical or the resident has to go talk to the surgeon, and that's how it goes.
Yep.
And so basically the patient has low potassium, but at one point the resident says, well, the patient's potassium is very low, so we're going to have to cancel the case. And the surgeon looks at him and he goes, why don't you just correct it really quickly, which causes death? I mean,
Yeah, can't you just give him more?
That's how they kill inmates.
Yeah.
They
Can't
give them
that
a high
kill the
dose of
patient?
potassium. And you see both their eyebrows, he's both characters, the eyebrows go up. So it's very entertaining. Definitely go to that guy.
Yeah, it's really funny. I mean, probably not that funny to people who don't understand surgeons.
No, I think that would be funny for non-medical people.
Not as funny.
Yeah,
I was laughing
I think the humor's
so
a little
hard.
bit dark.
Like when you sent that to me, I was at the gym and I was literally like, I was doing cardio and I was laughing so hard I had to like hold on to the side rails because I was afraid I was going to fall off the machine.
Yeah.
Like it's hysterical. Yeah.
I do think that medicine, and we try to do this too. I think it's analogous, is very serious and stressful, and you need humor to humanize it and to bring it down, because ultimately the whole the whole video was funny because in reality it was showing how surgeons could be complete assholes.
Yes.
But
that's what I mean. Unless you know surgeons, you don't get why that's funny.
And they're not holier
Call
than
my
thou.
financial planner.
Right.
My kids aren't. It's so over the top. So
At one point, he looked at the resident. He goes, "Did you do a fellowship in ruining people's lives?"
ruining everyone's day.
Yeah.
It was ruining everyone's day. Yes. Like that's the best line in that. Yeah.
Nils
All
would be
right.
like, "Okay, come on."
Yeah,
let's
like
go."
get back on topic. So who's a candidate? Anyone. men, women, as long as you're over the age of 18, and you want to address either by genetics, a lengthened upper lip, an upper lip.
So we
that's
have young
very turned
patients.
under.
We had one who just went through a marriage ceremony.
Went through a marriage ceremony.
What do you call that? Got married.
Got married.
Yeah. Had a wedding, and she wanted her lip to look a little bit better in a natural, subtle way. So that was an injection. We've had older patients we do lip reductions on because they've noticed over time, like me, that their upper lip is changing. So,
well, you don't need a lip reduction.
A lip lift, excuse me. I meant lip.
Yeah.
So, it just depends, but it's people that either have lack of volume of the upper lip, asymmetries, meaning that like the upper lip is a lot less volume, has a lot less visible volume than the lower lip, or a long length between the lip and the nose itself. So, and then this gets into a whole subset of post-traumatic injuries, of which I tend to take care of a lot of those. So I'll do like unilateral injections on one side, not the other, to make everything kind of, balance out. And that's where the lip reductions come in too.
Yeah. And sometimes we'll do that just temporarily. I mean, filler, that's the great part about filler, is if you have had like a traumatic injury and you have a lot of swelling or inflammation on one side, we can balance that out with a little filler on the other side while you're healing, so you don't look so weird. And that's actually been really nice for some of our patients who've been in really bad bike accidents and have just really bad inflammation, like really fat looking lip that is going to be swollen like that for months. Like, let's just put a little filler in that other side and not going to feel so freaky.
It is weird how many people hurt their lips. It's such a small area on your body, and it's like,
well, but it also, we do facial trauma.
Yeah.
So do other doctors perceve that there are a lot of lip injuries? Probably not.
I feel like every other person injures their lip when I'm on call.
Well, we start trauma call in less than in a week. So we're gonna get to see. I mean,
that's what I'm going to be watching, the funny videos on TikTok about doctors, because I'm going to be like, I hate every ER doctor that calls
facial
me
trauma.
Yeah.
Yes. So we see a lot more lip injuries than, say, an orthopedic surgeon.
Yeah.
All right.
Dog bites are the big ones. Yeah.
Yeah. So we've covered this throughout the entire podcast, but just to reiterate, what are alternative treatments to any of these things? Fillers, Botox. We didn't talk about that. Botox in some cases can help address some of these asymmetries in the lip. They can have downsides, like it can kind of change the way you express or talk. We talked about that in our episode about Botox, which was in 2022.
So if you have the orbicularis oris, right? Muscle, the muscle that goes around the mouth. Okay. And when that fires and gets excited, it contracts in, right? So it goes horizontal or parallel to your vermilion border or the red part of the lip. So the lines that develop with that usually go perpendicular to that. That's what you see in almost all areas of the body. So they're vertical lines. So the idea is you paralyze partially that muscle around your mouth so that the vertical lines don't crease as much. The problem is you have a secondary effect of that. Mm-hmm. Your mouth moves for obvious reasons, because when you talk, you make faces. I'm doing that right now on YouTube. Yeah. No one can hear that. But and if you limit that, it looks kind of weird. So you'll see these people with a lot of Botox in their lip, they'll talk like this. Like it's almost
looks very flat.
It looks flat. It looks like they went to the dentist.
Yep.
That has that feeling.
They also can't use a straw, which we do warn our patients. Like when we do Botox in the lip, like you will not be able to drink out of a straw.
We had one patient say something. I can't say it on here, but it was very funny.
Can't purse your lips. Let's just
can't
put it
purse
that
your
way.
lips. She made a very funny joke, and I was like, that's not the conversation I want to have.
Well, but see, there's downsides. So you paralyze a muscle, Fat transfer, we talked about that as well. It's going to add volume that's more permanent. We usually have our patients start with filler to make sure they like the volume. And then we also kind of know how much, filler it took to get the appearance that they liked. And then we kind of know where to start with how much fat transfer. It's not a lot. In most cases, I would say the very most fat we transfer to a lip, upper and lower, maybe 3 cc's.
Yeah, and I'm sure people do more, okay, but we're very conservative.
You can always do more.
You can always do more. Remember, if you go back to our fat transfer episode, 60% of the fat makes it usually in best case scenario. And that's going to be less in areas of high kinetic kind of movement areas with a lot of muscle movement.
Not a lot of space.
And that's why filler in the lips goes away fast. That's why fat doesn't take as well. So it's harder for the fat to take in there. Now, the benefit of the face for fat transfer over most other areas, the face is very vascular. So or you feel confident that fat's going to get a lot of oxygen, which is what it needs to survive immediately upon injection. And the idea of fat transfer and how it works is it's a miracle. I mean, you take fat from one area, just inject it in the other, your body somehow surrounds it, gives it a blood supply, and it makes it live, which is pretty amazing.
Yeah, and doesn't just turn it into
get rid of it.
Yeah.
So
just a flat cell. So fat transfer is great. And when my comment with saying how small it is, it means that this is something that it's not a huge ordeal. Like, yes, it is a little bit of liposuction to get this fat out, but it's a small amount. So if you need more, it's very little. Like, it's not like if you're doing massive amounts of fat transfer, like to the breast or to even like the hands or the full face, like you need a lot more fat, but a little bit of fat transfer to the lips, super easy procedure, very little downtime, very easy to recover from.
Yeah, we have a lot, well, not a lot. We have a few videos on our YouTube channel with fat transfer, a device called Beautyfill, which we got recently, which is really good. We're an educational site for that device. And on there, we show injection into the breast, and we also, I think we have one that shows injection into the face. We haven't had one specifically for the lip, which would be good to put on there at some point. So I'll try to earmark that, put it on my list. I have like my to-do list for videos is like literally 20 things long, right? And it's never going to happen. I need to like offload that to somebody.
Wouldn't be the same. Yeah. So let's talk downtime and recovery. Obviously, downtime and recovery is going to vary amongst these procedures. I would say truly the easiest to recover from is probably a lip reduction, because that incision is inside the mouth. That tissue heals incredibly quickly.
Right.
Like so fast. Those cells turn over so fast.
I won't even take the sutures out. I'll put like a dissolving suture in there, and it just kind of heals really quickly.
Yeah. We'll have you do some oral rinses with like a very medical grade mouth rinse for probably the first week. In
some places, we'll have you do half water, half hydrogen peroxide after every meal. You have to be careful with brushing your teeth, but it's pretty straightforward.
Yeah, very easy to recover from. Very minimal downtime. You wouldn't want to do any intense exercise for at least a week just so the area can heal without stress. But pretty much not that life invasive. Sutures that are dissolvable. Like, it's very easy to get back to just your normal life. A lip lift, we talked about that incision. It's long, right? It's long and it's visible. So while that incision is healing, while you have sutures in place, you can expect to have sutures for, I would say, 5 to 10 days that are visible. The suture material is black or blue, so it's very visible. It's going to be hard to hide. You can't put makeup over it. So you've got to plan for that. So for that first, 10 days probably, I would say you're going to need some downtime, not only socially, but also even from things like being on video with work, in front of people that you work with, that's going to be very obvious. People are going to know that something was done.
Yeah.
So that is your biggest downtime. Is it painful? No. You are going to have some restrictions on, again, like some activities based on the surgery. Not a lot of intense exercise right at first. Maybe some other things we don't want you doing right away. Biggest recovery, which might surprise people, is definitely going to be fat transfer to the lip and the lip implant, because both of those things you have to treat very delicately for an extended period of time.
Yes.
So even things like kissing, we're going to have you not do for probably 6 weeks.
What?
Like intense kissing.
That's crazy, Amy.
Yep. Or other types of sexual activity that may require you to put pressure on your lips.
What activity would that be, Amy?
This I'm not going to go there. You call me. Yeah. But because you're putting pressure on that soft tissue, so you don't want to put pressure directly on the fat because you want it to live.
Right.
So anything where you're really putting a lot of pressure on your lips, you're going to want to hold off on. I think that's the biggest thing to keep in mind. With the implant, we don't want to displace the implant. So again, we're going to want you to keep it very delicate around that area for a few weeks.
Yeah, and fat transfer, we talked about exposing the fat or your skin to excessive cold. So if you live like right now, it's low temperatures, that could be a problem for the fat graft. So the fat graft is a lot of work for the first at least 4 weeks.
Yep. You're treated like a newborn baby.
You have to treat it well. And that's, we have an episode on BBL. We talk all about this too. So fat transfer, wherever you put it, it's a currency. You have to protect it.
Mm-hmm. Yeah. So, but overall, none of these are painful. I mean, really, the most painful one is going to be the lip fat transfer, because you have to do a little bit of lipo, and even a tiny bit of lipo is still going to hurt. So
yeah, the lip lifts are surprisingly not painful, which is crazy if you think about it.
I mean, you have a small incision, but it's just incisional pain tends to be kind of burny and stingy, but it's not like you have like deep soft tissue pain.
3 to 4 days, and then you're really doing well.
I mean, we wouldn't even prescribe pain medication for it. Like you take Tylenol for a couple of days if you need it, and most people don't even need it. I would highly recommend, if you have really bad allergies, you don't do your lip lift during the height of allergy season, because you are going to have some restrictions on blowing your nose aggressively. You have an incision right there. So that's something to keep in mind with the recovery.
Yeah, we've never had someone have a upper respiratory infection with following a lip lift. That would be a problem too.
Oh, you'd just be miserable.
Yeah.
You'd be neti potting it a lot because you can't blow your nose.
Lip lift, the more I think about this, it has that direct excision neck lift feel to it. So like our direct excision neck lift patients, you put a scar in the midline of the neck. That's a great video on our YouTube channel. And you think that, like it's going to be a problem, but after about a couple weeks, you can barely see it, especially in men, because their kind of beard grows back over it. and it's just goes away, and then they move on with their life, and it's never really a problem. Lip lift has that quality to it. But
it's hidden in the shadow of your nose. You can put makeup on it after 10
totally.
days.
Lip lift definitely takes surgical skill. I can tell you this because I do it. Okay, so
and you can't go back once that skin's gone. It's gone.
So you got to really pick that person well. I think the filler injections, I would prefer you to pick people well, but I mean, no one does.
No,
so,
and eventually filler goes away. If
and
you
then
love
it goes
it, if
away,
you hate it.
and we can take it out with hyaluronidase. So like a lip lift or fat transfer, you just really need to go to
or
an
an
expert,
implant.
like a facial expert, and an implant also.
Yeah. And that is one thing to keep in mind. Like if someone is over aggressive on your lip lift and your lips no longer touch, I mean, we talked about this with our episode about eyelid surgery. You're going to deal with the repercussions of that, dry mouth, other issues. If too much of the wet vermilion is showing, that looks weird. That's why people get lip reductions. So it needs to be, just right, like lifted enough that it gives you the result you want without being lifted too much, because you can't put that skin back.
Right.
So pick your surgeon wisely.
We have an episode on that too, Amy.
We do. Pick your plastic surgeon. So thank you everyone for listening to this episode. Before you go, it is January 1st. And Dr. Martin, I have something for you.
Oh, God.
Nils knows. So what's this slide say?
Live your best life challenge.
So Dr. Martin has a milestone birthday coming up this year, and I'm not going to say what it is.
Oh, God.
But I will tell you this. I had a milestone birthday in 2020 during the height of COVID, and it sucked.
Okay.
I mean, I was surrounded with people I loved, and that was amazing.
Yeah, I mean, I was there.
Every restaurant on earth was closed. Everything was it was just so anticlimactic. So
but we worked out together. We were working out.
We were working out in
literally
storage unit.
A storage unit.
Yes.
That's how we celebrate Amy's birthday.
Yes, working out in a freezing cold storage unit. So it got me to thinking, I think that I would like you to look back on this momentous year and think, wow, that was the best year of my life. So I would like to challenge you. So February 1st, we come back February 1st.
Yes.
We will, if you accept this challenge, which you don't have to. This is your choice. This is your life. This is your life.
Okay.
We each pick things that we want to work on for the year.
Wait, do I have to talk about the dysfunctional home life that I love very much?
No. You get to pick what it is. So it could be that you want to increase your sleep score, or you want to, do a photo shoot. So,
good.
And I also want to put this challenge out to all of our listeners. We said in our last episode of the year that we wanted to have more interaction. So this is a perfect way.
Okay.
So Dr. Martin, will you accept this challenge?
100% I'm accepting this challenge. Is this something that I could be number one in? Yes.
Yes. This is literally yours. Yes.
Can I win this?
You are literally the only person on earth who can win this.
I know.
Yes. So only you can win this.
I'm going to kick my own ass.
Yes. So I was thinking it'd be really fun. And I did tell, in full disclosure, I told Nils, this was an idea that came to me at the gym, so it might suck.
No, I love this idea. And so I want the rules of the game real quick. So just lay it out so the listeners know too, and they can do the same thing.
Right. So you get to pick. So you get to look at your life and think, these are the things that I want to accomplish in this year.
Okay. And every month I'm doing one thing. Is that what you mean?
It could be the whole year. So my goal, I have, so if you take it, I'll take it too. And my goal is one set goal, essentially, that I will work toward, and then that will be the goal.
Okay.
Or you could pick something that you work on, throughout the year.
I'm going to do that. I'm going to do something every month, but then make it cumulative. So by the end of, are we going to my birthday or just?
We're going to the end of the year. Yep.
End of the year.
Yep.
I'm going to be a machine.
Yeah. Okay, there you go. So please, if you're
World,
listening,
you better watch out.
Yes. Pick your challenge. Let me know what it is. Send me
awesome.
a comment.
I'm so happy you did this.
And then on February 1st, our February 1st episode, that's when we're going to actually talk about what our specific parameters are and what our goal is.
Okay.
So you guys have a month. You have 1 month, the whole month of January.
Everyone's got to figure it out.
Yes. 31 days to decide what your best year should look like and how you get there.
And we'll
help you.
We have an episode on New Year's resolutions, which never works out well. And the main reason that people...
Goal setting. It's on goal setting.
It's on goal setting. Mm-hmm. You got to set the goals, make them achievable too. Okay.
Smart.
Yes. You can't not make... They have to be achievable, right? So I realize I'm not going to the NBA. I realize that now.
That's not going to be your goal?
That's not going to happen.
Okay. My goal is not to be a supermodel, so there you go.
You could be, though. You have the height.
I don't.
And the blue eyes and the upper lip, and you got going on, sister.
Upper lip. You got that beautiful upper lip. So yes, whatever it is too, we'll support you. So if you tell us what your goal is, we'll help, and we'll do check-ins along the year, and we'll help you too. And if there's something that we need an expert to come on, there is a specific expert that I will be reaching out to, but he just happens to be at the Olympia today. So not real reachable. But there are people that we're going to reach out to as experts. At least I will be reaching out to experts to help me with my goal.
Well, if you're going to reach out to experts, I'm reaching out to experts too.
Yeah, and I'm super excited.
My experts, not your experts.
So this is like a redo of 2020 for me.
I love it. Okay, this is good.
And this,
this is a good way. By the way, this is one last thing. I know this is, people are going to be like, why do they keep talking about this? But so my wife decided this year to do, who's an amazing person. I love her so much. So she decided to do a solstice party. Have you heard of this?
Oh, so you mean last year? Because it's 2023 now, remember? So she did a solstice party in December.
I'm sorry.
I
forgot about internet
the
time.
whole Mayan faith was based around the solstice.
Right. So
sacrifice a virgin, let's get the sun back.
So the whole idea of the solstice party, which is on the winter solstice, which is already passed, by the way.
December 21st.
So what you do is you take a piece of paper, you write on the piece of paper something that you want to leave behind in that year. Maybe something that was painful. I lost my dad. Amy's lip drooped a little bit. That's what she was really upset about. So you can put that on that piece of paper and then you burn it. It's kind of like, okay, it's gone.
People do that with the full moon every month.
Right.
Like, yes, that's a great tradition.
And then apparently you write something also, and maybe this is what you share with the group. We did it, but I can't remember what we did. How about that? So, and then you share something with the group of what you want for the future. And I thought that was wonderful, right?
Yeah.
So this has this quality to it.
Yes.
This is leave the bad stuff behind and bring the good stuff.
Right. Best year of your life.
Yeah.
This is going to be the best year of your life.
Perfect. I'm ready.
I can't sing. So thank you, everyone, for sticking with us to the end. If you would like to leave us a comment, please do, about your best year of your life challenge. Here's all of our social media handles. The phone number is in the drawer because I didn't get it out. Oh, there it is. Yep, no, it's my bad. 303-630-9038. See, I do have it memorized. I just don't believe myself, especially after Nils told me I said the wrong number once, even though it was right in front of me. So please leave us a voicemail.
That'd be funny if it was your ex-boyfriend's phone number.
Which one?
Touche.
Yeah. Like, good luck finding any of them. So thank you, everyone, for listening. I'm super excited about 2023.
Yes.
Even though it's an odd year, and I have historically said I don't like odd years, but you know what? The even years have not worked out for me. So let's bring on some
We're down with the odd years.
Bring on some strange.
Yeah.
Yes.
Let's do it.
Thank you, everyone.
Thank you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.